Ձիահը առողջապահական ճգնաժամից վաղուց ի վեր վերածվել է սոցիալական ճգնաժամի։
Այսօր ձիահի համաշխարհային օրն է։
Դեկտեմբերի 1-ը աշխարհում նշվում է որպես ձիահի դեմ պայքարի համաշխարհային օր։
Ողջ մարդկության ուշադրությունը այս օրը սևեռված է ձիահի խնդրի վրա։
Մեր երկիրը ցավոք արմատին չմնաց այս աղետից։
Հայաստանում միավ վարակի առաջին դեպքը գրանցվել է 1988 թվականին։
Ընդհանուր հաշվարկային տվյալով Հայաստանում ապրում է 2300 միավ վարակակիր։
Գործ ունենք լրջագույն խնդրի հետ։
Այն դարձել է ոչ թե մեկ ազգի կամ տարածաշրջանի, այլ համայն մարդկության լրջագույն մարտահրավերներից մեկը։
Միավի վտանգի առջև բոլորս հավասար ենք։
Շատ երկրներ իրենց ազգային ծրագրերի շրջանակներում փորձում են պայքարել այս հիվանդության դեմ։
Եթե պետությունները համատեղ միջոցառումներ չիրականացնեն միավ ձիա խնդիրներով, ապա մարդկությունը կկանգնի ձիայի գլոբալ վարակի սպառնալիքի առջև։
Պայքարի գլխավոր ուղղությունը շարունակում է մնալ կանխարգելումը,
ժամանակին տեղեկացված լինելու եւ բուժում ստանալու։ Պարագայում հնարավոր է երկարացնել մարդկային կյանքը։
Միավով կարող են վարակվել ցանկացած տարիքի մարդիկ։
Դրա դեմ պայքարել անհրաժեշտ է ամեն օր։
Հիվանդության դեմ պայքարի խորհրդանիշը դարձավ ահա այս կարմիր ժապավենը։
Years ago, the National Center for AIDS Prevention of the Ministry of Health took up the challenge of AIDS and today continues to respond effectively to this problem, stopping the HIV epidemic spread in Armenia. Only 20 years ago, the center had a few rooms, and today, thanks to the years of state assistance, introduction of effective management systems, creation with the various grant support of modern infrastructure and constant technical upgrades, it is a modern medical facility where experienced qualified staff work. Here, every visitor receives comprehensive services of high quality, including free anonymous HIV testing, psychosocial counseling, and psychological support. Confidentiality is guaranteed. Experienced professionals make accurate diagnostics in state-of-the-art laboratories. Follow-up care of the patients includes various immunological, virological, biochemical, and clinical tests, as well as HIV drug resistance and HIV genotype tests. The only reference laboratory in Armenia which makes the final HIV diagnosis regularly undergoes the external quality assessment. Over 2,000 HIV patients receive free treatment and specialized medical care in the center. Ultrasound, X-ray examinations, and TB screening are performed here. Providing comprehensive co-located services is in compliance with the WHO approaches and is in the patient's best interest. That allows organizing the most effective treatment. Also, legal counseling is provided to patients and their family members. Epidemiological surveillance ensures measuring the epidemic and trends over time in Armenia, evaluating effectiveness of the implemented programs, developing and introducing targeted preventative activities. The developed information materials and educational activities help to raise HIV awareness, promote forming safe behavior, and HIV testing. And thanks to the HIV testing conducted in the center's mobile clinics during public events, more people become aware of the HIV status and receive the necessary treatment, care, and support. The mobile clinic's operation also improves access to HIV services for communities, including the most vulnerable to HIV population in Armenia, outbound labor migrants, among whom the center performs a great amount of preventative work. The center participates in the regional scientific research initiatives, due to which the center is also provided with expensive equipment and test kits, therefore reducing the state budget burden in this area. The employees' abstract and posters are presented at various international conferences. The center also serves as a basis of the National Institute of Health. It has many years of experience in effective organization of academic and training process. Experienced trainers work here. There is a technically equipped training center which hosts national and international conferences, meetings, workshops, trainings, seminars, and video conferences. Thanks to the effective management and well-organized work of the AIDS Center's staff, united by common ideas, the center has achieved many successes, and today it is internationally recognized as one of the best in the region. In 2017, the National Center for AIDS Prevention received a UN Public Service Award for innovation and excellence in public services, having become the first, and as of today, the only governmental institution in the country which received a UN award supporting implementation of 2030 Agenda for Sustainable Development. And awarding the prize of the President of the Republic of Armenia for 2018 in the area of medical science to a team of specialists of the National Center for AIDS Prevention is a considerable assessment of the work performed by the center. The AIDS Center, by its effective performance, has ensured a high international ranking of the country's health system, making contribution to significant achievements in this area. In 2016, the WHO validated Armenia as a country that eliminated mother-to-child transmission of HIV, and then approved the status maintenance for 2016 to 2017. By ensuring that women living with HIV gave birth to HIV-negative children, Armenia has proven by practice that HIV-positive women's desire for healthy children is quite attainable. HIV testing quality is being controlled. Starting from 2001, no case of HIV transmission through donated blood has been reported. Starting from the year 2017, the country has introduced the strategy Treat All after making diagnosis. A continuous chain of the drugs order, procurement, and supply has been introduced, making Armenia a country in the region where no treatment interruptions have occurred. In accordance with the strategic programs of the Ministry of Health, the country has a closely integrated system of services on HIV/AIDS, tuberculosis, and maternal and child health protection. Almost all pregnant women and TB patients are tested for HIV. Diligent and dedicated work of the center's employees, to which high value has been repeatedly attached, guarantees the achieved successes. 30 years is too short a time for the history, but for the AIDS Center, it is a period of growth, overcoming the challenges of recognition, of continuous achievements due to the hard work performed by the dedicated specialists. The Armenian AIDS Center took up the AIDS challenge 30 years ago and will continue under the leadership of the Ministry of Health to make committed efforts to achieve HIV-free generation, ultimately ending the AIDS epidemic.